Pancreatic cancer is one of the deadliest cancers out there, not because it's the most common, but because it's often caught too late. By the time symptoms appear, the disease has usually advanced, making treatment incredibly challenging. In fact, pancreatic cancer is the third leading cause of cancer-related deaths in the U.S., and its 5-year survival rate remains alarmingly low. Why? Because the pancreas sits deep in the abdomen, and early warning signs can be subtle or mistaken for minor digestive issues. But here's the good news: recognizing symptoms early could mean the difference between life and death. In this video, we'll break down 6 shocking warning signs of pancreatic cancer that most people ignore. Plus, we'll go over key risk factors and what to do if you notice these symptoms. Stay tuned, this could save your life. Number 1. Jaundice, yellowing of skin and eyes. Jaundice is one of the most noticeable and earliest warning signs of pancreatic cancer. It causes a yellowing of the skin and the whites of the eyes, often accompanied by dark urine and pale stools. This happens because of a buildup of bilirubin, a yellow-brown substance produced by the liver when it breaks down old red blood cells. Normally, bilirubin is processed and excreted through bile, but when something blocks this process, it accumulates in the bloodstream, leading to jaundice. In pancreatic cancer, jaundice often occurs when a tumor in the head of the pancreas blocks the bile duct. This prevents bile from flowing properly, causing bilirubin to build up. Unlike jaundice caused by conditions like hepatitis or gallstones, pancreatic cancer-related jaundice often appears with other symptoms, making it an important red flag. Along with the yellowing of the skin and eyes, people with jaundice may notice dark brown or amber-colored urine due to excess bilirubin being filtered through the kidneys. At the same time, stools may become light or clay-colored because bile is not reaching the intestines to provide its normal brown color. Another common but often overlooked symptom is intense, persistent itching, pruritus, which happens when bile salts accumulate in the skin. This itching can be severe and may not respond to moisturizers or anti-itch creams. If you or someone you know develops sudden jaundice without a clear cause, it's critical to see a doctor right away. Since pancreatic cancer can be difficult to detect early, imaging tests like an ultrasound, CT scan, or MRI can help identify blockages or tumors in the pancreas. Don't ignore these signs. Early detection could make all the difference. Number 2. Persistent nausea and vomiting. Persistent nausea and vomiting can be an early but overlooked symptom of pancreatic cancer, especially when they occur frequently and without an obvious cause. The reason? As a pancreatic tumor grows, it may press against the stomach or small intestine, creating partial blockages in the digestive tract. This interference can lead to ongoing nausea, difficulty digesting food, and episodes of vomiting. Unlike occasional stomach upset that improves with rest or medication, cancer-related nausea tends to persist and gradually worsen over time. One key feature of pancreatic cancer-related nausea is that it doesn't improve with common treatments like antacids, dietary changes, or over-the-counter nausea medications. It often gets worse after eating fatty or heavy meals, as the pancreas is responsible for producing digestive enzymes that break down fats. When a tumor disrupts this function, the body struggles to digest certain foods properly, leading to discomfort and a growing intolerance for meals that were once easy to eat. Beyond nausea and vomiting, other digestive symptoms may signal something more serious. Many people experience early satiety, meaning they feel full after just a few bites of food. This can contribute to an unexplained loss of appetite and sudden weight loss. Additionally, bloating, excessive gas, and discomfort after eating may accompany these symptoms, making meals an unpleasant experience. If you or someone you know has persistent nausea, vomiting, and unexplained weight loss, it's essential to seek medical attention. These symptoms, particularly when combined with jaundice or changes in stool color, could indicate a blockage in the bile duct or digestive tract caused by a tumor. Endoscopic imaging, CT scans, or MRI tests can help detect abnormalities in the pancreas and determine whether further investigation is needed. Ignoring these warning signs could delay a crucial diagnosis. Early detection is key. Number 3. Unexplained itchy skin, pruritus. Persistent, unexplained itching might not seem like a cause for concern, but when it occurs alongside other symptoms, it could be an early warning sign of pancreatic cancer. This type of itching is caused by a buildup of bile salts in the skin, which happens when a tumor in the pancreas blocks the bile duct. Normally, bile flows from the liver into the small intestine, helping digest fats and remove waste. However, if a tumor obstructs this pathway, bile backs up into the bloodstream, leading to intense, persistent itching that standard treatments can't relieve. What sets cancer-related itching apart from common skin irritation? First, it's typically generalized, meaning it affects the entire body rather than just one specific area. Many people describe it as deep, relentless itching that feels impossible to scratch away. Unlike itching caused by dry skin, allergies, or insect bites, this type doesn't improve with moisturizers, antihistamines, or over-the-counter anti-itch creams. It also tends to worsen over time and may appear before jaundice develops, making it one of the earliest symptoms of a bile duct obstruction. Of course, itching alone doesn't mean you have pancreatic cancer. Other conditions, such as liver disease, kidney failure, allergies, and certain skin disorders, can also cause widespread itching. However, if persistent itching appears alongside symptoms like jaundice, dark urine, pale stools, nausea, or unexplained weight loss, it's crucial to seek medical attention. A doctor can order tests, including blood work and imaging scans, to determine whether the cause is related to pancreatic function. Early detection is key, and recognizing this subtle yet significant symptom could lead to a life-saving diagnosis. Number 4. Upper abdominal pain, radiating to the back. Persistent upper abdominal pain that radiates to the back is another critical but often overlooked symptom of pancreatic cancer. As a tumor grows in the pancreas, it begins to press on surrounding organs, nerves, and tissues, causing discomfort that can become more severe over time. Unlike temporary stomach aches from indigestion or minor infections, this pain doesn't go away and tends to worsen gradually. One of the key characteristics of pancreatic cancer-related pain is that it starts in the upper abdomen and spreads to the lower back. Patients often describe it as a dull, deep ache rather than a sharp or cramping sensation. Another important detail is that the pain worsens when lying down but improves when leaning forward, a distinguishing feature from common digestive issues. The discomfort may also become more intense after eating, particularly fatty foods, because the pancreas plays a crucial role in digesting fats. When a tumor interferes with this function, eating can trigger additional pain and discomfort. Of course, not all upper abdominal pain is due to pancreatic cancer. Several other conditions, such as pancreatitis, gallbladder disease, stomach ulcers, and acid reflux, can cause similar discomfort. However, what sets pancreatic cancer-related pain apart is its persistence and gradual worsening over weeks or months. If you or someone you know has ongoing upper abdominal pain that radiates to the back and doesn't improve with lifestyle changes or medications, it's crucial to consult a doctor. Advanced imaging tests like an MRI, CT scan, or endoscopic ultrasound can help detect abnormalities in the pancreas. Catching this symptom early could lead to a life-saving diagnosis and treatment. Number 5. Sudden onset of diabetes. Most people think of diabetes as a lifelong condition that develops due to genetics, lifestyle, or aging. However, what many don't realize is that a sudden onset of diabetes, especially in someone with no prior history, can be an early warning sign of pancreatic cancer. The pancreas plays a crucial role in blood sugar regulation, as it produces insulin, the hormone responsible for moving sugar from the bloodstream into cells for energy. When a tumor develops in the pancreas, it can interfere with insulin production, leading to unexplained diabetes. Unlike type 2 diabetes, which usually develops gradually and is often linked to weight gain, pancreatic cancer-related diabetes tends to appear suddenly and may progress rapidly. It can also affect those who have no family history or common risk factors. In some cases, people who already have diabetes may find it increasingly difficult to control their blood sugar levels, despite following their usual treatment plan. Frequent thirst, excessive urination, unexplained weight loss, and blurred vision are common signs of diabetes, but when they occur suddenly and without a clear cause, it could be a red flag. If you or someone you know develops diabetes out of nowhere, especially without being overweight or having a family history, it's important to look deeper into the cause. A doctor may recommend blood tests, imaging scans, such as a CT scan or MRI, or further pancreatic function tests to check for abnormalities. Since pancreatic cancer is often diagnosed late, recognizing diabetes as a potential early sign could be life-saving. If something feels off, don't ignore it. Early detection is key. Number 6. Changes in stool and urine color. Most people don't pay close attention to the color of their stool or urine, but these changes can reveal important clues about your health, including potential signs of pancreatic cancer. The pancreas plays a key role in digestion by producing enzymes and assisting bile flow. When a tumor blocks the bile duct, it disrupts this process, leading to noticeable changes in urine and stool color. One of the first signs is dark-colored urine, often described as brown or amber. This happens because bilirubin, a substance normally excreted in bile, accumulates in the bloodstream instead of being eliminated properly. At the same time, stool may become pale, clay-colored, or grayish because bile isn't reaching the intestines to give stool its normal brown color. Another major red flag is greasy, floating, foul-smelling stools, a condition known as steatorrhea. This occurs when the pancreas isn't producing enough digestive enzymes to break down fats properly, causing undigested fats to be excreted in the stool. These stools can be difficult to flush and may have an oily appearance. While changes in stool and urine color can result from diet, dehydration, or medication, persistent changes lasting more than a few days should not be ignored. If these symptoms appear alongside jaundice, unexplained weight loss, nausea, or upper abdominal pain, it's time to see a doctor. Imaging tests like an MRI, CT scan, or endoscopic ultrasound can help detect bile duct blockages or pancreatic abnormalities. Recognizing these warning signs early could make a crucial difference in detecting pancreatic cancer before it progresses. If something seems off, trust your body and seek medical attention. Risk factors for pancreatic cancer. Pancreatic cancer can develop in anyone, but certain risk factors can significantly increase the likelihood of getting this deadly disease. Understanding these risk factors is crucial because those at higher risk may benefit from earlier screenings or lifestyle changes that could lower their chances of developing the disease. One of the biggest non-modifiable risk factors is genetics. If you have a family history of pancreatic cancer, especially in a first-degree relative, parent, sibling, or child, your risk is higher. Additionally, certain genetic mutations, such as BRCA1 and BRCA2, which are also linked to breast and ovarian cancer, can increase susceptibility. If pancreatic cancer runs in your family, genetic counseling and screening may be beneficial. Age is another major factor, with most cases occurring after age 65. As we age, our body's ability to repair damaged cells declines, making cancer more likely to develop. While pancreatic cancer is rare in younger people, it becomes significantly more common in older adults. Smoking is one of the biggest modifiable risk factors, as it doubles the risk of developing pancreatic cancer. Tobacco contains harmful chemicals that can cause genetic mutations in the pancreas, leading to cancerous growths. The good news? Quitting smoking can gradually reduce your risk over time. Certain chronic conditions also play a role. Diabetes, especially when it develops suddenly in someone with no prior history, has been linked to pancreatic cancer. Additionally, chronic pancreatitis, a long-term inflammation of the pancreas often caused by heavy alcohol use or gallstones, increases the risk of cellular damage that can lead to cancer. Obesity and a sedentary lifestyle contribute to chronic inflammation and insulin resistance, both of which can raise pancreatic cancer risk. Maintaining a healthy weight through diet and exercise can help lower your chances of developing the disease. Lastly, exposure to workplace chemicals, such as those used in the metalworking, petroleum, and agricultural industries, has been linked to an increased risk of pancreatic cancer. If you work in these environments, taking protective measures, such as wearing proper safety equipment and reducing exposure to harmful chemicals, may help lower your risk. While some risk factors cannot be changed, others, like quitting smoking, staying active, and maintaining a healthy diet, are within your control. If you have multiple risk factors, consider discussing pancreatic cancer screening with your doctor. Early detection could be life-saving. Pancreatic cancer is a silent but deadly disease, often showing symptoms only when it's advanced. However, recognizing early warning signs, such as jaundice, persistent nausea, unexplained itching, abdominal pain, sudden diabetes, and changes in stool or urine color, can make a life-saving difference. If you experience multiple symptoms, don't wait, consult your doctor immediately. Understanding risk factors like family history, smoking, obesity, and chronic conditions can also help you take proactive steps toward prevention. Early detection is critical. If something feels off, listen to your body and seek medical attention. Knowledge saves lives. If you found this information valuable, like, share, and subscribe to spread awareness. Your support helps others stay informed about critical health topics. Stay proactive, stay healthy,